Huples cat, how bad is the pandemic and how bad could it get? Stay tuned for not a very optimistic journey. First off, some data. COVID-19 official death toll is approaching 500,000 worldwide. Of course it varies from country to country, but overall it's significantly higher than seasonal flu. But that's bad enough. I mean, if you catch this and die, that's bad. But if I catch it and I die, it doesn't really have any impact on you. But how many people does it take to die before systemic fear breaks out in an area? How many people need to die from COVID-19 in your particular location before people in that area stop doing normal things, like working, and food supply becomes a problem? The truth is nobody knows. What we do know is that as death rates rise, normal life becomes less and less likely to continue. And with a significant pandemic like 1918-1919 Spanish flu, for a period of a week to 3 weeks in various parts of Canada, England and America, normal life basically ceased. Now you could argue that our normal life has basically ceased recently, but it's been a decision to lock down, or it's been a decision enabled by governments and or employers to avoid people going into work or going into school or going into sports arenas, to avoid spreading the contagion so we can flatten the curve, keep the infected and the dying going for longer but at a lower level, so health services don't fail and overall people are fairly protected, but significantly the overall death rate would drop. However, it's getting to the point now where even people in the United States who are in charge of the United States, like Vice President Pence, are actually now starting to socially distance. Now the fact that they're doing socially distancing visibly when they're doing news conferences on the 27th, 26th of June is very significant. They should have been doing this a lot sooner. Of course, the official death rate is almost 500,000 and the official infected rate is almost 10 million globally. As you can see from this, the shape of the curve is quite clearly a curve that is not falling. The question is, have we flattened the curve enough that when it stops being flattened it will take off again? Nobody really knows. What we do know from historical data analysis is that all infectious disease curves, as many people die coming off the peak as die going up onto the peak. So we're at least looking at 1 million cases worldwide of death this year from COVID-19 disease. But of course that's not the full story. Official counts of death rates from COVID-19 globally underestimate the number of people who die from COVID-19, and there's various reasons for this, and I'll put some of them up now so you can look at them. But overall, during positions of lockdown or people being scared and so self-lockdowning, we actually would expect a drop in death rates in the early part of the pandemic. We wouldn't expect a large rise in people dying because they didn't go to emerge. Yes, some people didn't go to the emerge departments and died because they were frightened to catch COVID-19, so they died of a stroke or a heart attack at home. But overall, you would expect the number of traumas to drop, a lot of other things to drop, a lot of violent crime. You'd expect things to drop. Now obviously there's been social disturbance in the States. What we do know is baseline death rate data is mostly first world. Mostly rich developed countries know how many people die and how many people are born. But we do know from looking at cities and countries that the baseline death rates for COVID-19 are exceeded. So there is no particular way of putting this other than to say, if 1 million people have died right now from COVID-19 directly or indirectly, I wouldn't be surprised, speaking globally. So that puts the American actual death rate at around about 250,000 right now. That's reasonably significant. So as of today, June 28th, the situation continues to deteriorate globally and in some countries. I just want to point out to people that what we're getting now from the data, remember we needed the data to occur and analyse the data before we could actually say what was going to happen. This is a novel, a new virus. It looks like that. There's a 5-week period on average, can be shorter, can be longer, from significant population mingling, person to person mingling without masks, without real hand washing, talking loudly and singing. There's about a 5-week delay. That is what we're looking at. So it's very important to understand that when you don't have many cases in your area, you need to be wearing a mask, limiting contact with people and washing your hands. That's critical. Absolutely critical. So I just want to point out that the United States is having it bad, so it's a good example. But nationally and globally, when you look at their statistics nationally compared to global, America is kind of bad, but it isn't really bad. Countries like the United Kingdom, managed to kill more of their population. So it depends on how you look at it, but the States is a super region of different states. It is, that's how you set it up. And so is Canada to some extent, and so is Australia to some extent. But today, on June 28th, there's 4 American states that have COVID-19 disease under control. 4. Everybody else doesn't have it under control, probably should still be in lockdown. Some of them definitively should be in lockdown, but are not. So you can look at the maps and you can see what's going on in your own area and what's going on locally, but bear in mind, Huples Kittens telling you there's a 5-week delay from exposure to significant cases in your local community. 5 weeks. On average. Can be longer, can be shorter. So protect yourself until global infected new daily cases drop significantly, and then keep protecting yourself for a further 5 weeks. I was saying 3, I'm now saying 6 weeks. 5 plus 1. So looking at the continental United States as 4 sub-regions, you can see from this that quite clearly Northeast got bombed and has really controlled it now, and Midwest is starting to uptick after controlling it. The South has really not controlled it. They did flatten the curve, but they didn't drop the curve, and now it's taking off. And the same basically for the West. This is not good news. It's not good news longitudinally. The reason it's not good news is because significantly there is control measures now being put in place during the surge. The control measures needed to be done at least 5 or 6 weeks ago. Getting rid of the control measures during the upswing will help, but it won't drop the caseload on the death rate and the illness rate significantly, as it would have done if they were able to put those lockdown measures in place before. But what does it look like when a country, say China, has a significant surge and locks down aggressively, a bit late but earlier than the United States did, and Britain and Canada, and controls it? What you see is that you see the case fatality rate, the death rates from COVID-19 drops over time. The reason being that the ill people who are going to succumb to the disease are not out and about in public. So the people who are actually still catching it, it's households and people working because they have to in a lockdown. The issue is, has America, has Canada protected its old people well enough? And I think it's pretty obvious from what's happened in all of our nursing homes, we didn't. And I would argue we're still not. A lot of the nursing homes in Canada are opening up now. As the community starts to open up now, it's a recipe for a surge, it's a recipe for a repeat disaster in terms of death load by infecting the most vulnerable. One of the many bad things that came out of the early phase of COVID-19 disease in China was the assumption and the proof from the Chinese that you had to be very old and you had to be sick already before you died from COVID-19. And that happy thought has pervaded throughout our consciousness with great strength, and it's not true. It isn't true at all. The amount of people who die from COVID-19 disease who have a comorbidity is around about 50-50 for people who have none. And that's really significant given the fact that most of the death rates are older. Above 50, above 55. You pick your money, you take your choice. I'm 56 next month. The bottom line is that if you are elderly and you are sick and you catch COVID-19, you're much more likely to die from COVID-19 disease than if you were younger and fit. What is not true, and has never been true, remember the doctor that whistleblowed on COVID-19 disease in China got stomped on by the police in early January 2020 was 35. And he died of it, and he was fairly fit and well. There was a point of time where every single COVID death, when they were rare, was being reported in the West as comorbidities, had comorbidities, had comorbidities. Everybody, including babies, had comorbidities that died of it. The truth is, when you look at the data now, that was absolutely skewed. It wasn't true. Initially it was probably true in China because the outbreak initially was the food market, but before they died they all went to the hospital that was nearby, and the hospital spread it to all the nurses and all the doctors and all the patients, effectively, not all of them but a lot of them, especially cancer patients. So the comorbidity data and the age data was right at the outset wrong. It didn't represent the comorbidity data in the population and the death rate in the population. My message is, if you're 1 day old or 112, COVID-19 can be caught by you and it can kill you. Much more likely if you're 112. Babies, we're not quite sure what's going on with kids, but again, it's a novel disease. So stay safe, keep protected, wash your hands frequently, don't go in public sphere unless you have to, and if you do, always wear a mask and wear it properly. So whatever your biases are, you'll find evidence, statistical evidence that your bias is truth. It isn't truth. This disease is 20 or more times more contagious than seasonal flu. It spreads very slowly through the population, very slowly. It's going to be around for months to years. Until we get a vaccine, it's going to be around. The thing is with this disease that it accumulates in populations who are not wearing masks and who are gathering in public and specifically shouting and singing, and about 5 weeks later you get a mega spike. It is bad. It's killed a lot of people on this planet. It's probably killed twice as many as reported. Who knew? Who really knows? We won't really know until this is over and we can go back and look at the death data. If you die from a heart attack because you don't go to hospital because you're afraid of catching COVID-19, or you go to hospital with COVID-19 and die, COVID-19 indirectly and directly killed you. The disease killed you. It doesn't really matter for me if I die from not going to the hospital because I'm scared, or if I die from COVID-19. I'm still dead. I'm going to do what I can do rationally to protect myself, and that means wearing a mask. N95 if you have them in public, please. N95. Reuse them, bake them, 170 Fahrenheit for an hour. If you haven't got that, use the best surgical mask you can get. If you haven't got that, use the best bandana, the best system you can create. It isn't about making a political point. It's not about virtue signaling. It's not a fashion statement. Well, in some degrees it is. Wearing a mask in some degrees says, I believe COVID-19 is real. I believe it's killing people. I'm going to do whatever I can, even if it's not great, to try and stop other people from catching it and dying. So you could argue it is a virtue signal, but it actually does reduce, scientifically reduce, the chances of you catching it slightly if it's a surgical mask or less, and a lot if it's an N95, if they're worn correctly, if they're taken off correctly. So the statistical analysis of this is still being done, and it won't be done for a year or two in any reasonable, accurate way. All we can go by is what we're seeing, what we're thinking. Listen to scientists, listen to doctors, listen to nurses, listen to respiratory therapists, listen to paramedics. Don't listen to people whose self-financial interest is for you to go back to work and die. Because most people won't die from it. So the argument being, well, who cares? The economy. So again, World War II showed that the economy can be shut down for 6 years in parts of the world and a few years in the States, because you're always late to world wars. And please try and keep that one up. And it can be done, but you have to transfer cash to the population who are not working, right? You have to, and it has to be regular, it has to be stable, and you have to do what you can do to limit the spread until such time as we get a vaccine or it plays its way out through the population. But I did say I would talk about how bad this could be. Now this might come off as fear porn, so I'm not going to talk about fear porn initially. I'm going to talk about what is actually happening. And I'm going to talk about some projections. I projected 2 million North Americans dead. Well, I projected 2 million United States citizens dead by the end of this. I still maintain what I'm seeing, that's a minimum death rate for the United States before this is over, 2 million. I can't see any way out of this. Hey, we could have a magic vaccine. The virus could mutate itself into nothingness. All of those two miracle things could happen, but they would effectively be a miracle. So if you look at the data that we have now, food insecurity is becoming a big problem. Both climate change, human population explosion, soil erosion, water loss, soil depletion, a whole bunch of other things. GMO seeds that can't self-reproduce. There's a whole bunch of issues there that means that food insecurity in our world is very real. I have done some numbers on this, I've looked at this, and I firmly believe by 2022 the world's demand for food will be the world's demand for food will be higher than the supply. That's going to cause political instability, pain, misery, death. It's already happening. Syria and Yemen are really, really at risk right now, today, from mass starvation because of COVID-19 is limiting the money people are prepared to give to other countries to stop their children from dying, and also because of war makes it less likely that people will go in there and feed those people, and because of COVID-19 there's a lot of flights have been cancelled, a lot of shipping has been cancelled, and a lot of borders are closed. So international aid has been really, really dinged. And you may not care about that, but you will care about it if it's Mississippi that has an insufficient food supply. So I will talk a bit about that. Now that is kind of fear porn doom, but I want to talk about the actual psychological and physical effects of this disease being largely left unchecked in parts of the world. In a lot of ways, SARS-CoV-2 virus that causes COVID-19 disease is absolutely fascinating. We hear a lot about asymptomatic carriers. Of course, the most famous asymptomatic carrier ever is Typhoid Mary. She actually died at the age of 70. She had typhoid, she had no symptoms, and she could spread it. She infected a ton of people just by making spaghetti for them. Poor old Mary. She died in quarantine. She spent her life in quarantine. Now, it would be a good idea to put all the asymptomatic carriers in quarantine for life. It's not going to happen. One of the reasons it's not going to happen is that this disease has a phenomenal amount of asymptomatic carriers. Even the old CDC, which is still active by the way, even though they are now publishing their own data as private scientists because the government won't publish it, which is again very scary, almost like North Korea. They have estimated for every American infected with COVID-19 disease that's been diagnosed, there's 10 more who have it. They're asymptomatic, they're wandering around. Now if you look at the Alps, the Tyrol, they did some studies on this as well, and what did they find? Well, they found quite clearly that their ground zero, when they looked at antibodies, they found that only 15% of people with antibodies were infected. So they're estimating 85% of people are infected and asymptomatic. Now that does not necessarily mean that they can transfer and transmit the disease. It probably means they can. And certainly it would explain a lot of the transfers that are occurring, a lot of the surges occurring, if there are asymptomatic carriers around who are infecting everybody. So this is why testing is so important, because we were trying to find people who are asymptomatic to make them lock themselves away from everybody until hopefully they become non-infectious. It doesn't take a rocket science to figure out that with 85% of the cases non-diagnosed, non-diagnosable with an infectious disease, if people are out and about doing normal things and not wearing masks, not really washing their hands that well, and ignoring small symptoms because they have to go to work, because there's not much in place to pay for their house if they don't, that you're going to get a massive spread. The other thing with this disease is it doesn't really infect a lot of people. There was early reports out of the States that 80% of people in California were infected with it. Absolute twaddle. That was only put out there in the world by liars to make sure that people felt safe and able to go to work. Well, who already had it, why not, right? The truth is it's round about between 2 to 10% of the population in any given country of the world have had exposure to COVID-19 disease, to the SARS-CoV-2 virus. There's a large percentage, the vast majority of human beings, have not been exposed to this. So with the death rate already at 125,000 in the United States of America, if the other 90% of the population, or 80% or 70%, or even 50%, well, you can make it whatever number you like, but the data suggests it's no more than 10% at max, and that's only in hotspots. If they actually then develop the disease, you would definitively see a rise in official death rates, which I believe are at least half of the actual death rates from COVID-19. You would see them spike. You would see those death rates go from 125,000 to approximately 1 million or more, which I believe is 2 million. So that's why I'm saying 2 million. It's also based on Spanish flu. So this disease is going to kill a significant number of the population before it burns itself out, is mutated into nothing, or everybody's had it, or we have a vaccine. We're looking at months of continual deaths and illnesses all across the planet. Sometimes very few for weeks at a time, then a whole bunch more, depending on contact tracing, lockdown, and the population's acceptance of hand washing, mask wearing, and limiting exposure to other people, both at work and at play. This is a really, really interesting time. It really does mirror what happened in 1918 in the United States and Canada and England. We're all in this together, and we're all doing similar things. But of course, America is exceptional in how extreme it takes things. And I think that's part of your national psychology. But you've really got to stop this. If you are a right-winger, if you support Trump, please wear a mask. Please encourage other people to wear masks and wash their hands, and maybe contact your congressman or even contact Trump by Twitter. Let him know this is not a political issue. Americans cannot go to work safely in a pandemic without precautions in place. It's not to be ignored, it's not to be trivialized. If only 1% of the population who die are young, fit people, children say, and that appears to be what it is, about 1%. If 1 million Americans die, that's 10,000 dead children. If 2 million die, okay, you get it? You understand what I'm saying? And that's with the virus not mutating, not doing anything differently than it's doing today. So with 10 million confirmed cases, we have 500,000 dead. Okay? If we get 100 million cases, which is entirely possible, we're going to have 5 million dead. I'm saying it's double that. I may be right, I might be wrong. Who knows? What I am saying is that even if this disease does not mutate to be more killing than it is right now, we are facing 2 million Americans dying over the next 18 months. It's going to have an incredible social effect. Schools are going to get shut down in the fall. It's going to cause lots of problems. Already United Kingdom's talking about putting Leicester, a city, into lockdown. You're going to see repeat lockdown openings. You as a human being, you owe it to yourself and your family to wear a mask in public until the pandemic is over. And the pandemic is not over until there are no more new global cases. It's that simple. It's really not rocket science. It's simple. Wash your hands, make sure you have soap and water, make sure you have hand sanitizer, make sure you have a good supply of masks, the best masks you can get, and use them and recycle them. Don't treat anything anymore as single use. And this includes things like getting paychecks. Don't assume that a paycheck is for single use and you just splurge it. You may find yourself unemployed. You may find yourself unemployed with minimal or no government assistance for a prolonged period of time. We will emerge from the pandemic if we can avoid war during the pandemic. Actually in a boom, an economic boom. It will be like the roaring 20s. It will be a fantastic time. Business will open, people make loads of money, people will go on cruises, it will be wonderful. But we have to go from here to there. And to get from here to there, we have to accept the fact we are in a global SHTF. This is a pandemic. All of those preppers out there still wearing beards. What are you thinking? Why are you doing that? Really? Come on. Seriously. Think about it logically. It absolutely makes no sense to put a barrier between you and an N95 so the seal's not correct. You can put tea tree oil in, you can do whatever you like. It makes no sense. It also makes no sense to go to a patio to have beers because your council or your government has told you it's safe to do so. It makes no sense. There's a 5-week lag time between opening and surging in cases, and the world is extremely connected. Throughout this whole period of time, people have been flying into and out of the United States and Canada. A large number of people. Even good old New Zealand. It managed to control it by shutting its borders. It's now letting infected New Zealand people back in and having a difficult time controlling itself. Really? Come on. We have to realize that we can't just build a wall and protect ourselves and live like normal. We have to understand that we have to live with a pandemic for probably 18 to 26 months. Anyway, in SHTF, tomorrow's always worse than today, unless you prep. And in a pandemic, prepping means washing your hands, wearing a mask, not going out in public unless you have to, and being very conscious of the fact society has fallen in a controlled way and will not be normal again for months. Get over yourselves and understand that. Now, if there's any interest in the comments, if anybody's gone through this to this point, if you want me to look at possible mutation and worse effect, I'm happy to do so. It would be fear porn and speculative, but if you're interested in that, using my registered nurse ability and my emergency planning background, I actually could foresee that this, as bad as it is, and it is bad, could be a lot worse. If you're interested, let me know. I can bang one together for next weekend. In the meantime, stay safe, stay happy, and try and keep cheerful. Toodles. This was a Wonderful Cat production, 2020. Talking loudly.